Welcome to Glen Talks, where we talk about all things in the world of business in the local community. We offer inclusive insights and exclusive experiences. Today's topic of discussion hits close to home in the construction industry, where we talk about the broader issue of mental health and providing supports that workers need to be able to make it home safe and to make it back to work healthy and in good condition. There's a lot of things that affect workers in the industry. Long hours, night shifts, working out of town, periods of unemployment. These all can wreak havoc on a person's mental health. Workers and co-workers for us are like family, and when we see someone struggling, we want to be able to help. There's a number of programs and services that are available, and one group that has developed some products and services to help service the industry is the Independent Contractors and Businesses Association. Today we are joined by Chris Gardner, who's going to introduce his mental health and wellness program that the ICBA has developed for the industry. Construction workers are 25% more likely to die by suicide in this industry, and we need to do something to help. And thank you so much, Chris, for your work that you guys are doing, and we'd love to hear a little bit more about your program. Thanks for joining us.
Thank you for the opportunity to be here today on the podcast.
Can you share a little bit about your journey that had led you to lead the Independent Contractors and Businesses Association, and how did your career progress?
I joined ICBA. I'm in my 8th year. So I joined in January of 2017. And, the association has grown quite significantly since then. We're now the largest construction association in Canada, one of the biggest business organizations. We've got over 4,500 members and clients. We have nearly 200,000 people on one of our health and dental plans. And we are the largest sponsor of construction apprentices in British Columbia. So before I joined ICBA, if you go way back, I was born in Newfoundland, in Labrador, actually. You won't meet too many folks who were born in Labrador. And moved to British Columbia when I was 10, went to SFU, did my undergrad there, went to UBC Law School. And after law school, I wanted to live and work in Asia. So I ended up going to Seoul, South Korea. And my 1 or 2 year plan turned into 11 years. And that was fascinating, really enjoyed living and working in a very dynamic part of the world. And Korea at that time, very fast growing economy. And so it was very exciting. And I learned a lot. And then I came back. And when I came back to British Columbia, I joined a modular construction company called Britco, and then worked there for about 8 years. And construction is a fascinating opportunity, fascinating industry. The creativity, the technology, building legacies. So that transition into working at ICBA was a very natural one.
Mm-hmm. And can you provide a little bit of an overview of the ICBA, of who the ICBA is and what they do and how they service the industry?
Yeah, so we're member focused. And so we touch our members in lots of different ways. So a member could be just a member and then receive the benefit of all the updates we give on the industry, what's happening, and what's happening in the industry could be related to technology, could be related to new policies or programs that a level of government is rolling out, whether it's City Hall or Victoria or Ottawa, could be related to issues that we think are important that the industry needs to understand and advocate for change. And then we have a wide variety of services. So members could also be on one of our health and dental plans. We could be the sponsor of their apprentices. We offer a lot of our services for free. So apprenticeship sponsorship is one service we offer for free. We do all the paperwork. We're the interface between Skilled Trades BC and the employer and the apprentice. It takes a lot of work off, especially small contractors. So we try and make their life easier so that they can focus on what they need to focus on, which is winning and executing work and recruiting and retaining employees. We do a lot of public policy advocacy. We do have networking events. We're not an event-heavy organization. So when we do events, we want it to be meaningful. We want it to be interesting. And we want it to be something that a member says, yeah, I'm going to take time out of my busy schedule to go to this event because I'm going to learn something, or I'm going to meet people, other leaders in the industry. So that formula I think is working. We recently expanded to Alberta. We now have ICBA Alberta. We have an office in Calgary, and we're growing there as well. So I think the platform is it's a very exciting one, and it's one that's growing, and that growth and that excitement is really around what we do to serve members.
So in terms of things that are kind of plaguing the construction industry from forward progress right now, what do you think some of the hot button issues are?
Well, every year we survey our members and clients and ask them about what are the top challenges that are facing your business. And it's been fairly consistent for the last number of years. The first one is a shortage of people. We have a shortage of people in our economy, and certainly that's being felt acutely in construction. So shortage of people is number one. The rules, regulations, and red tape that are related to project approval and permitting is always going to be in the top 2 or 3 issues. It just simply takes too long to get projects approved and permitted. And you would think that in the middle of a housing affordability crisis, that the exact opposite would be the case, that governments would be doing everything they can to approve projects faster. But it is a challenge at City Hall. And then you look at some of the rules and regulations that are applied by the province or the federal government. Makes it very, very difficult. So that is, so shortage of people, the rules and red tape around project approval, and permitting, top 2 issues. Then you've got, sort of the other regulatory framework that can be a hindrance to contractors, and that would be WorkSafe BC policies, for example, or other regulatory entities where they just change policies and they say, well, this is going to help. Oftentimes it doesn't help, and it can be confusing, it can be complex, and it can be costly. So there's those series of issues. And then something that started to show up as we before the COVID-19 global pandemic, there was a lot of conversations around mental health. But as we sort of went through that pandemic and came out the other side, it's now one of the issues that contractors are saying is significantly impacting their workforce, and there's concerns about mental health. And so that our surveys are showing that. I mentioned earlier that we have nearly 200,000 people on one of our health and dental plans. So we get a lot of data on the drugs that doctors are prescribing. And what we noticed as we were in the middle of COVID is on every single health and dental plan, the number 1 category of drugs prescribed by doctors are drugs for ADHD, depression, and anxiety. Number 1 on every single plan, and in terms of volume of prescriptions. And so we found that quite alarming and said, well, we got to do something. We have to help the industry respond in a way that's going to be meaningful for their employees. So we worked with experts, psychologists, we worked with contractors and workers, and we developed an innovative mental health program for construction professionals. And so we rolled that out. We offer it for free. We have 10,000 people enrolled in the program. And it's a program where every month there's a different theme. And the theme in one month might be substance abuse. The next month it might be financial challenges. Next month it might be a disease, a diagnosis, a health challenge that someone might be facing. Like all of these are triggers for mental health challenges. And so if one of those issues is relevant to an experience that someone is going through, there's an online learning module, and there's lots of resources. You can spend hours going through the material, getting the kind of background information and resources that could be helpful. And so we're excited about the program. We've rolled it out. Again, it's free to our members, and it's being adopted by our partners in other provinces. So we're excited that we've been able to develop this, but it's unique to construction. There's a lot of materials out there to talk about mental health. But really, if you go to a job site and leave a brochure and there's a whole bunch of folks doing Pilates in the boardroom, that's not really relevant to construction workers. So we've tried to make everything around it relevant to a construction worker, to the men and women who wake up every day and go build our communities. So those would be the top 4 issues.
And it's interesting you're talking about approvals and stuff right now, because you coming out of Modulars as well, hearing the rejection by Squamish on the flotel,
right.
And going through all of the rigmarole of getting all of the approvals, and then the very last stage, suddenly a change, and that can have devastating effects on the execution of a project. Do you have any thoughts on how that had?
Well, I think the interesting thing about project approval is that most projects, and it can be it can be just a single family home that's going to be redeveloped. It could be a new road, a new bridge, a multifamily complex, an industrial project like a pipeline, or like the Squamish, the wood fiber LNG project that you mentioned. Generally what's going to happen is people say, yes, we want that to go forward, but not in our neighborhood, somewhere else. Build it somewhere else, but just not here. People don't like change. They don't like change that's in their immediate neighborhood. And so when you talk about density, when it comes to housing or a new road or a new bridge, a new high-rise tower, people will say, well, the views will be obstructed, or there'll be more traffic, or there'll be more noise. And so we've got to get through that. And this is where we need political leaders to stand up and say that if you live in the city, you have to accept that there's going to be density. And that's what makes cities vibrant and exciting. That there's a lot of people, and there's lots of restaurants and entertainment facilities, and that's an advantage of living in a city. And on the industrial side, we need pipelines, we need roads and bridges, we need ports and airports, and the wood fiber LNG project is something that provides. Canada has an abundance of LNG. This can be part of of Canada helping the world transition to cleaner burning fuels. We have an enormous advantage, and we should be taking advantage of that opportunity. And more oftentimes in Canada, we don't, and we say no. So if you look at if you look at Canada, where Canada ranks in the length of time it takes to approve a major construction project, the World Bank says Canada ranks number 64 in the world in the length of time it takes to approve a major industrial construction project. Number 64 is an embarrassing statistic. We have to do better, and we can do better. So the flotel that the wood fiber LNG project proposed was to bring in a cruise ship, house the workers in the cruise ship to minimize the impact on the community, not distort housing prices. And so during the phase of construction, the impact would not be as great as it would be if you had those 600 workers trying to find accommodations in the Squamish area.
Taking up the rental market.
Right. Yeah. So it was an innovative solution. And the fact that council didn't approve it, the obvious question is, what do you want? And so those are the kinds of challenges we have to overcome if we're going to compete against other countries like the United States and other countries around the world, where investors are looking for opportunity. And if we want to have, if we want to be able to provide all of the social services, education, hospitals, schools, interesting opportunities for families to build communities, we need to have a strong economy. And these projects are vitally important. Challenges, we're saying no more often than yes. And I think it's hurting our competitiveness.
Do you find that maybe our drop in some of those numbers to a lower threshold, or to a lower number in the approvals, could that maybe be from the proactive adoption of UN DRIP and stuff like that? Because that's a little bit more, conversations need to be had with the nations individually, and there's a lot more considerations that we have on these projects now than we had previously.
Well, I think actually, Indigenous engagement is an opportunity to get to yes faster. So if you look at the wood fiber LNG project, Squamish Nation ran its own independent environmental assessment and approved the project. And in fact, they approved the project at the same time or before the provincial government did. So the holdup here is it's not the Indigenous community saying no, it's actually the local Squamish council saying no. And then if you look in the city of Vancouver and you look at the Sinnock project, which is a residential project at the foot of Burrard Street that's owned by the Squamish Nation, that project has moved incredibly fast. And that's because the Squamish Nation said, we want to build this. We want to build more housing. And because it was on Squamish Nation land and territory, it didn't have to go through the regular City of Vancouver approval process. That's why it moved faster. And so if we get this right and we engage Indigenous communities in a meaningful conversation about the shared opportunity, shared decision-making, and equity ownership in projects, I actually believe that we will get to yes faster. Because I think if you look at most city halls and most industrial projects that require provincial or federal government approval in this country, we have a very poor track record of getting to yes in a timely basis. And the cost overruns are enormous. And you can look at the Metro Vancouver wastewater treatment facility on the North Shore, where that budget was less than $1 billion. It's now estimated to be closer to $4 billion, and a decade over schedule, and still no plan to get this thing built. If you look at the Site C Dam, we need hydroelectricity. That project is behind schedule and over budget, and to the point where last year, British Columbia, we have an abundance of hydroelectricity. We imported 20% of our electricity last year, which is equivalent of 2 Site Cs. We have to build more, and we have to build it faster. And then if you look at the Trans Mountain pipeline expansion, that project went from an estimated construction budget around between $8 to $10 billion to about $34 billion. And so we don't do a good job of building these big projects. They're all over budget. They all take far too long to build. And again, it comes back to having a mindset that says we've got to get to yes, we've got to get there faster. We need this infrastructure. We need it to have a stronger economy, to provide opportunities for young people who are grappling with the challenge of buying a home in most major cities in this country. And so the way through that is to provide them with opportunities for high-paying jobs.
Mm-hmm. Do you find that sometimes some of these cost overruns, they come from the low bid getting the win all the time? Afterwards, there's a lot of the extra cost plus, all of the deficiencies, all of the other stuff that kind of weighs on top of the timelines on these projects. So do you think that there needs to be maybe some reshaping in terms of policy on how these projects and the proponents are selected?
I don't think government, and most of these projects are government owned and administered. Mm-hmm. And I think generally government doesn't do a great job of procuring large projects. And oftentimes the process is set up where there's this inherent conflict between the owner, government, and contractors. So I think there has to be more collaboration. And I think there has to be, government can't just approach a project and say, every single risk on this project is your responsibility. Mm-hmm. We're not going to take any risk. And when government says that, what contractors do is say, well, if I'm responsible for every risk, even the risks I really can't assess very well, I'm going to put that in the price. That just does nothing but drive up the cost of that project. So the conversations around risk and an appropriate sharing of risk are very important. Also, how we contract. So, the provincial government has now, a number of years ago, rolled out a new program called Community Benefit Agreements. And Community Benefit Agreements basically say that only building trades certified companies can bid on the work and can execute the work. And so if you look at the construction workforce in British Columbia, 15% we've got about 230 to 250,000 workers, men and women working in construction. About 15% are building trades. The other 85% are either non-building trade certified, employee associations, or non-union. And so when the government says, well, we're just going to, basically only 15% can either bid and work on these projects, well, what's going to happen. There's going to be less competition, less bidders, and prices are going to go up. Those contracts are more complicated to administer because now they've created a new Crown corporation called BCIB that administers the contract. The workers have to become employees of the government. Now, I don't know why a government would say, hire contractors to build something and say your employees now have to become government employees. It kind of doesn't make sense. Again, it's costly, it's complex. Government should do something very simple when they procure projects. Free, open, transparent procurement. Everyone's welcome to bid. And it's not about the low bid winning, it's about the best bid winning. And that best bid can be a combination of, do they have the experience? Do they have the expertise? Have they got the right partnerships in place? Can they execute according to the schedule? All of those things are important. It's not just about the lowest bid, because sometimes, to your point, the lowest bid is not going to get us there, and it will end up costing us more in the end.
Yeah, or they kind of skip town and.
That's right. Yes, as happened in the North Shore.
Yeah, I think it happened. I think if I remember correctly, I remember something in the news from Golden Years Bridge. I think there was something that had happened there at one point in time, but I was pretty young at that time. So I think tying all of this back in, it's with this mental health crisis that we're having coming out of the pandemic. This being, I think, a topic that's really close to heart for a lot of people. For also keeping in mind the opioid epidemic that we have. I just checked the numbers again today, and it's heartbreaking and sad to see that the numbers continuing to climb, and we're closer to 7 overdose deaths a day in BC now. How is this issue close to home for you? And how did ICBA come to the decision to start building out your mental health wellness program?
Yeah, I think, my comment at the outset was that ICBA is member-driven and member-focused. And we had members call us up and tragically explain situations where workers had taken their own life and had done so in sometimes like on the job site. And so that's obviously a horrific tragedy for not only the family, but also the colleagues, everyone who's working on the site who knew that person. And so to us, we just felt that we had to help in some way. And so our program is really geared, it's really focused on one very simple thing. Let's just make it easy for people to put their hand up and say, I'm struggling. And then someone, if they hear that, and on the other side of the conversation, not feeling awkward or embarrassed, I don't know what to do, to say, okay, we understand. And so now that we can, the conversation started, here are the resources we have, or here's what we can do to help, or, there's folks you can talk to. We've got an employee assistance plan in our health and dental plans, whatever the case may be. But just making it easy for people to have that conversation and not feel on either side of the conversation embarrassed or awkward or afraid to start the conversation. And you mentioned that the opioid crisis that's raging through across North America, in British Columbia, 7 people a day are dying. And, it's not, and it cuts across all demographics. Most of those people who are dying alone at home. A lot of people will think that, well, it's just the downtown east side of Vancouver, and that's not the case. So, every workplace, once you have, people working together, it could be 10 people, it could be 100 people, it could be 500 people or more. You're going to have people at various phases of their life going through different challenges and struggles. And invariably, you're going to have people who are struggling with mental health in some way, shape, or form. And so it's incumbent upon everyone to be part of that. Well, let's support people, and let's do what we can to give them the resources they need to get through that. That's really the focus of what we're trying to do as part of our mental health program.
So speaking about the shift in workplace culture, there's been a lot of attention and a lot of pilot programs that have started. Don't Be a Tool is one of them. And a couple of other groups have some fabulous training, such as Don't Be More Than a Bystander training. So I think that all kind of wraps in. Like, this is a very multi-layered issue affecting the construction industry, but broader community as well. Myself coming out of kind of road building civil sector, I know a lot of people that have had a lot of struggles over the years, and absenteeism is a big part of it. And it's lots and lots of money that is lost in the industry when you lose somebody as well. So speaking to your app and your platform, do workers have that opportunity as a member of the organization that got access to that platform? And then if they are struggling with their mental health and they, perhaps aren't working there anymore, do they still get access to that? Or?
So the way the program is designed is that we have, it's a combination of toolbox talk material, posters, and then the online module where everyone who's enrolled can go in online, and there's a lot of resources there, and it's set up by different themes. So if someone is very interested in a certain area that's impacting them, or maybe one of their colleagues or a family member, they can go in and work through all of that information. Lots of resources there. we've got about 200,000 people on one of our health and dental plans. We encourage all of our members who are on one of our health and dental plans to do two things. One is look at their plan and think carefully about the part of the plan that provides support for psychologists and for help with people who need help who are struggling with mental health, because you can increase that coverage level. And the other thing we encourage them to do is add an employee assistance plan to their health and dental plan. And that provides free counseling services. People can call. Now, one of the things we have noticed, and a big challenge, is that now as more and more people are talking about mental health, okay, well, now they need to see someone. And the challenge is our healthcare systems are so much pressure that sometimes it can take a long time to get in to see a counselor. So it's not great if someone says, I'm struggling, and everyone says, okay, now let's go get that person in to see a psychologist or a counselor of some kind. And the appointment's 6 months down the road.
Yeah. So
our system, which generally is under a lot of stress and strain, and there's overcrowding in hospitals, shortage of doctors. All of that plays into the mental health challenge, because people need to get resources and expert help, and our system is breaking down. That's a big problem. So we work hard to try and get access to counseling resources as fast as we can to help our members.
Great. So do you find then, with some of the issues that I've kind of heard that are kind of a resounding theme that are addressing some of these issues that workers are facing, is, it's a hard macho man kind of construction industry, very male dominated. You don't really get to talk too much openly about, struggles that do happen. There's a lot of self-medicating on musculoskeletal injuries and some of the stuff that goes along with that. So is there any way to follow and keep in touch with these workers for the employers? Because obviously they have a great degree of care and investment that they've put into these people for them to hopefully get better. So is there any sort of a pathway for them to continue on with them before they start employment with another one of your contractors?
Yeah, well, I think so. The short answer is yes. That we live in an environment right now. So if you go back to your very first question, what are the challenges facing contractors? Shortage of people. So what's happening in construction? Well, the average age of, if you look at what's happening demographically, we've got 20% of the construction workforce that's aged 55 or older. The retirement age in construction is lower than the broader economy. It's about 60. So over the next 5 years, we're going to lose about 20% of the construction workforce. Huge challenge. So what do we need to do to address that? Well, the focus now is on retaining. Once you've hired someone, you want to retain them because it's so hard to find people. And so that goes to employers now looking at everything from how people are working to the health and dental plans, RSP plans, being a more engaged employer to keep people close to the company. So if someone does have a challenge, more and more employers now are saying, okay, how do we work with this person to get them through this, and so they can come back to work and help our company grow and help them support their families. So that's definitely a theme. Yes, on sites, it's male dominated, no question about that. Probably over 90% of construction workers on the site are male. In offices, you'll have more. Maybe it's something like 60-40 in an office. But yeah, on sites, definitely it's male dominated. And traditionally, that culture has been very much. You think about what part of construction is. Meeting deadlines, meeting schedules, and so if someone's in the middle of something, it's like, well, can you go through whatever you're going through on Saturday and Sunday and not now, because we got to be off the site at Friday at 3. So yeah, it traditionally that's been the case. Now I think that culture is changing. And I think it's changing because partly you got younger people coming into the workforce who think differently. So I think that's a part of the change. I also think just the fact that there's so much pressure on employers now because of the shortage of people, that the way construction contractors are managing their teams is changing a lot. So I think we're heading in the right direction. Lots more work to do, but I think we're heading in the right direction. And I like to say to young people who are considering a career in the trades that the opportunities in construction are enormous. If you think of the next 10 years in construction, the trajectory of this industry is on, there's going to be enormous opportunities. Just the pent up demand for housing and the infrastructure related to that. There's going to be trillions of dollars in new construction over the next decade in this country. So tremendous opportunities. And for young people, lots of time you'll be like, I'd like to own my own business. Well, if you want to own your own business, no better path to being an entrepreneur and owning your own business than learning a trade, getting some experience, and becoming a contractor, opening up your own business. Because every single contractor, every time you drive by a construction site and you see all those signs hanging there, most of the times they're family names, partners, people who took risk and started a business and grew that business. And nothing could be more exciting, building community legacies, hiring people, giving back to the community. Super exciting.
So looking ahead, Chris, how do you envision ICBA's mental health and wellness program and your other programs to meet the changing needs of the construction professionals, especially considering the ongoing societal and economic shifts? So how do you picture the future of this program, and what guideposts and metrics have you set for numbers to help build the success of this program?
Yeah, one of the things we learned as we launched it is that when the demand sort of exceeded our expectations. So now we've got 10,000 people enrolled. And initially we designed the program to be a 1-year program. So you go through the program, but then we realized that members would say, well, we want to stay on the program. So that drove, okay, new content. What are other features we can add on to the program? So we're doing a lot of work on that now. I think we've got 3 years of content built up. We're looking at always building and adding new content to the program. The construction industry is enormously exciting. The next 10 years in construction is going to be filled with opportunity, both in terms of just the demand for housing and infrastructure, but also in terms of how technology has changed in the way we design and build. And there are enormous opportunities in technology in construction. So if you're a young person in high school and you really like technology, you don't have this, the natural answer isn't, well, I've got to go work for Meta or Google or Amazon or a tech company. You can actually work in construction and use technology. And so there's exciting opportunities there. So, when I look at construction, it's a challenging industry. It's a rewarding industry. And the mental health program is part of the opportunity to support workers and companies because, at different points in people's lives, life is not a straight line, right? There's lots of things that happen. And so we want to make sure that companies, our members, and their employees have the tools to be able to work through challenges when they sort of land on their desk and they're like, I didn't see this coming. And why I didn't see this coming can be a whole bunch of things. It can be relationship challenges. It can be an illness. It can be sudden passing of a friend or a colleague. Like a whole bunch of things go on. So we want to make sure people have the resources and the tools to get through that. And because it's vitally important to support people when they experience these challenges.
Some of your other articles, you've highlighted a rise in type 2 diabetes among construction workers. And I think we're just still talking a bit about that health lens. And some of the new opinion that's coming out is that, the type 2 diabetes, it's a huge rise for people, particularly in this industry. But then we're also dealing with, people once past retirement, there's a higher rate of dementia and Alzheimer's, and it's being coined as type 3 diabetes now. So how does ICBA arrange support for conditions like diabetes in your health and wellness program? So do you have different levels of service, and does this help people into there's retirement options and stuff like that for these employees once they retire?
So on the diabetes side, so as I referenced earlier, in terms of by volume of prescriptions, by number of prescriptions, the number one category of drugs on every plan is prescriptions for anxiety, depression, ADHD. But in terms of cost, by dollar amount, the number one cost driver are prescriptions related to diabetes.
Mhm.
And so over the next decade, I think it's fair to say that diabetes will be the disease that defines a lot of what's going to happen in our populations and in the healthcare system.
Mhm.
It's like a tidal wave that's coming at us. And so it's a very, very significant challenge. And so what does that require? Well, it requires conversations around lifestyle choices that people make.
Right.
And so our health and wellness program is designed for that. There are modules on how to, after you have dinner at night,
Mhm.
don't sit down on the couch and watch the Canucks, even though it's exciting. Maybe watch
Most
the
of the
Canucks.
time until the third
Yes,
period. Yeah.
That's right. Maybe watch the Canucks, but then after that, go for a walk.
Mhm.
Be more physically active. Eat. Adopt healthier eating habits. All of those things. Try and decompress and take mental breaks and
Mhm.
take vacations and do all of the things that are going to be focused on your health and wellness. Because ultimately that will pay dividends for you as an individual, which will benefit your family and obviously your workplace. Now, for those who retire,
Mhm.
every single one of our plans has an option for the employee once they've left the company and they've retired to continue on the health and dental plan. Because they're already in the plan, they can just continue to pay themselves.
Yeah.
So they're not sort of cast off to the four winds, and
Yeah.
there's enough people for them to stay connected, which I think is important.
Yeah, I've heard some concerns from a few friends now that are at the retirement age. And some of them will have to like requalify and do the whole medical exam and all that stuff. And their premiums can be based on what their mental or their physical condition is.
Generally, if you do it within there's a window,
Yeah.
and each carrier, when I say carrier, like Canada Life, Manulife, Sun Life, will have different rules. But generally, you're within a certain period of time, 30, 60, 90 days, you're going to be allowed just to continue on. You're just going to have to pay those premiums. So now, if you like a year later decide to go back,
right.
then some carriers may require, and it's different for each carrier. Each program will have different requirements, but some may have medical evidence that's required.
Mm-hmm.
But generally, if you've just retired and you're still on the plan, you can convert that over, and there's no additional medical requirements.
So, Chris, in what ways is ICBA collaborating with other stakeholders in the construction industry to address the mental health challenges? I know there's a lot of close relationships with a lot of other partner groups. Are there any specific initiatives or partnerships that you can share that you're working on right now?
Well, there's we've been there's been last year there was a number of stakeholders that came together with the provincial government, with other health authorities, to talk about mental health in construction, mental health generally, but in construction specifically. And so that can be every agency from the BC Construction Safety Alliance, WorkSafe BC, the Ministry of Mental Health and Addictions. So all these stakeholders come together and talk about what are the things that everyone's doing, and how can we collaborate and learn from each other to get better outcomes. So those discussions happen all the time. And I don't think now there's not very many places you can go in construction where there aren't fairly open conversations around mental health, and here are the resources that are required, and let's make sure we're having these conversations and keeping an eye on each other.
Mm-hmm. It's a bit of a tumbleweed of circumstances in terms of how all of this stuff all kind of wraps together. I mean, certainly when we're talking about mental health, there's a number of things that plague it, and some of it's working out of town for months on end on some of these big projects, and there's a lot going on in the province right now. Then you've got access to proper housing. There's a lot of people that live in precarious living conditions that are, either getting rent-evicted or even trying to find new accommodation that can support their family or their pets. And then, you got a big increase in the amount of people that are immigrating into this province quite regularly. So how can we try and address some of these issues? I think housing probably has a big issue to do with that. And what sorts of struggles are we seeing there?
Well, housing is probably the number one issue on everyone's mind, whether it's, a young person or family trying to get into the market. When you talk about affordability, it's housing affordability is on the top of everyone's list.
Mm-hmm.
And so the challenge we have is getting enough supply of housing onto the market. And so there's a couple things that are going on. First, if you think about in 1972 in Canada, we built 230,000 new homes. Last year in Canada, we built about the same number of homes, about 240,000 new homes.
Wait,
so
what?
In 51 years,
Wow.
we have not moved the needle on supply. I think 1974, we peaked at about 270,000 homes.
Mm-hmm.
That was the highest in the last 52 years. And so we have not been able to build more homes. Now, in 1972, we had about 22 million people in the country, and now we have 40 million people in the country. So why aren't we building more homes? Why hasn't the industry scaled up? Well, part of it is the rules and regulations I talked about earlier.
Mm-hmm.
It should not take as long as it does to approve and permit a housing project as it does in every single major city in this country. It's tragic that, when you go in and if you just think of everything in construction that needs to be permitted and the length of time you go back to City Hall, we're always going back to City Hall. There are some very simple things we can do to take some of the decision-making out of City Hall. We hire all these engineers and consultants and architects, and then we put together these packages and we go into someone who's 25 or 26, who's a plan checker, has very little experience, and all of a sudden they're now got to approve this application. So we need to take some of the decision making out of City Hall. If you're going to add a deck onto your home, you shouldn't have to go to City Hall. So some of the simple things, get out of City Hall, make City Hall more efficient, so we can get things approved faster, and then we can build more. The second issue is the costs and fees that are layered onto housing. All the development cost charges, all of these extra costs that get layered onto the cost of construction. So the C.D. Howe Institute came out with a study last year, and they said that 62% of the cost of a new home in Vancouver is a result of fees and levies and taxes that are put onto the cost of building a new home by the city of Vancouver. 62%. So if the cost of a new home in Vancouver is about average home, $1.2 million, over $600,000, fees, costs, development charges. That doesn't make any sense. You talked about increasing population.
Mm-hmm.
So if you think about what's happening in British Columbia, in 2022, for the first time ever in British Columbia, more people died than were born. It's never happened before in British Columbia. It happened again last year. So without immigration, we're going over a demographic cliff. Our population is starting to decline naturally. So we need immigration. Challenge is, we added a city the size of Calgary to Canada last year. We added about 1.2 million people. We're going to do the same thing this year. So in 2 years, we've taken two cities the size of Calgary and plunked them down in Canada. That's how fast our population is growing. So what's happening? Affordability is being crushed, and our infrastructure being schools and roads and hospitals, communities are being overwhelmed. And so what's going wrong? Well, what's going wrong is a couple of things. Our immigration system does a very poor job of saying we need more doctors, nurses, technicians, tradespeople. Let's go get them and bring them to Canada. What we've done is just sort of open the door and everyone's coming in. So we need to do a better job of the permanent residents that came to Canada last year, a little less than 500,000. Only 2% went into construction. So less than 10,000 people. And we have a shortage of tradespeople.
Yeah.
Why don't we bring in more tradespeople? Really the pressure is coming from what are called the temporary residents. Temporary residents are people on a temporary work visa, international students, refugee claimants. Those are the three big categories. Right now in Canada, we have 1 million international students running around, and 20% of them will never go to class.
Yeah.
They will never go to class. Where are they going? Well, we don't really know where they're going. So I think the issue on immigration...
Well, they're probably going to work for subpar conditions and working more hours than they should. And,
so I think the answer is we need immigration, but we need to understand what is the number that we can reasonably digest. And what's the makeup of those who are coming in? Like, let's bring in people with the skills to help power our economy going forward, but let's bring them in at a pace that we can reasonably adjust to and accommodate in our communities. Let's not overwhelm our communities, because bringing in, a city the size of Calgary last year and this year, where the negative impacts are seen by so many and now starting to outweigh the positive impacts. And Canada's been a very warm, welcoming country in terms of immigration for decades. And so now we don't want to be in a position where we just get this, like, people saying, whoa, we don't want to have this anti-immigrant undercurrent start to develop. So how do we prevent that? Bring in people with the right skills and bring them in numbers that we can digest. So we just need a little bit more balance in our immigration system, because we need the people. Right? If we don't have the people, if we don't have a growing population, our long-term prosperity will be at risk.
You feel that some of these people, they're kind of coming in to do the work and then they're leaving again, that there should be a little bit more quicker pathways for these people to gain PR? And if they do come in, a lot of them are on closed work permits. Do you think that if there's definite necessity for them to be in the industry, that it maybe should be a bit of a different format for people, particularly in the skilled trades? Yeah,
if you're on a temporary work visa, what are we saying to you? Well, it's good enough for you to come in and work.
We need your skills.
Yeah, but once that visa is over and expired, then you got to go. You would think that if we need the skill, and this is where I do think there's got to be a little bit of balance. I mean, I think we do want an immigration system that says Canada's a place of opportunity, and so young people come and make your way in Canada with education, get trained, but we also need skilled people to come, and if we need them, then there should be a pathway. Come in and work, and if you work for a year or two, however long the visa is, and you like it, and you see opportunity, then yes, you're welcome to stay, and we want you to stay. So our immigration system, I don't think is working very well for us right now. We definitely need to reform the process so that we're bringing people with the skilled trades, offering them opportunities to stay, and bringing in people in the numbers that we can digest. And, part of the challenge is we set up these incentive systems that actually end up heading in the wrong direction or leading to outcomes that don't make sense. So think of, if you want to be a student at and study commerce at UBC, first year students who are Canadian pay $6,000 a year in tuition. Students who are international pay $60,000 in tuition for their first year. So for 4 years, that's $250,000 Canadian for a 4-year degree for an international student. So what has UBC done? They set up an international student recruiting center, and they go out there and recruit international students to meet their budget requirements. So we're viewing international students as walking ATMs. Yeah. And that is not healthy at the scale that we're doing it in Canada.
So you feel that there's been a bit of a recent squeeze on some of these career colleges and stuff like that to help try and catch some of this, but some of the bigger schools are doing that as well. So what's a good solve then for that? How do we address that?
It's not that UBC is not teaching people a quality education. The private ones where come in and learn how to be X, and we don't really know what X is, and we don't really know if the skill will actually get you a job. That's very problematic. So some of those private sector schools, the accreditation and the oversight has been lacking, and particularly in Ontario, it is a bigger problem in Ontario than it is in British Columbia. So we need to do a better job because we've also got an international reputation. You don't want private sector colleges going out making all these promises and bringing people to Canada, and they get here and there's 6 people in a basement, and they're learning. They're taking courses that are not. There's no real pathway to a job, and they're just basically taking the money from them or their families. That doesn't reflect well on Canada.
Yeah, so it's a bit of a temptation then for some of these groups, particularly for those that are coming in on work permits or student permits, to kind of prey on these people. So, in your opinion, then, what would be some things to help prevent that for both the workers and the students?
Well, one thing is that right now there's the federal government never had a cap on international students. They never had a limit. So if a if the province or an institution said we've started up a school and we're going to bring in 100 international students, then the federal government would just stamp the visas and there they go. That's it. That's broken down, and so there should be a number. I don't know what the number is. We need to have a conversation. There is a number. Like if somebody said, well, let's bring in, right now I said we've got 1 million international students studying in Canada. If somebody said we should have 5 million, we're like, whoa, no, we can't have 5 million. If somebody said we should only have 100,000, well, maybe that's too low. But there is a number that I think institutions and governments can have a discussion and say, okay, this is reasonable given the challenges with housing and the spaces we have in schools. The number should be this number. And it's the same thing with workers on temporary work visas. What is a number we can bring in where we can help them increase their skills and make sure they're working and provide pathways for permanent residency and citizenship. But we've never really had these conversations. And then all of a sudden, in the last 2 years, we've had this, influx of 2 million people in the last 2 years in Canada, 2022 and 2023. That's 5% of our total population that is now on our streets in the last 2 years. It's a big number. And you can see it. Like people can feel it and see it, whether it's in the cost of housing or what's happening in our education system or what's happening in hospitals. It's not about, we have to be careful. Like nobody wants to say, well, if we don't have immigrants, then all these problems are going to go away. That's not the case. We need immigration. Because as I referenced earlier, in British Columbia and Canada, like right now, Canada, natural births over deaths, it's about even. So our population is starting to decline as a country. And in British Columbia, it is declining without immigration. So we need immigration. That is the starting point. We need immigration. We need young people. We need skilled people. But we just need to do it in a way that's going to help us and not hurt us. And where everybody says, yeah, this is great for Canada. People feel good about it, positive about it. And when the people who come here, like there's a lot more stories now when you look at the media and what they're reporting out of international students coming to Canada and saying, I didn't realize it was going to be like this. I didn't realize I was going to spend so much in rent. I didn't realize that it was going to be so expensive to live in Canada. Maybe I should be going somewhere else.
And I can only work a certain amount of hours a week. And then if I want to work in excess of that, then, they have to make special deals and then they got to try and keep their grades up. It's very, very difficult to try and maintain. And, I had a couple of friends that were here from Ireland and they were doing concrete for me. And they ended up kind of giving up and heading back because even just the process, there was a program, it was called a TR to PR pathway program. And I think it was just a one-time thing for those people that were going through the COVID period there. And I'm curious to know what the number of skilled workers were that were actually accepted in that program. And there was a huge backlog for immigration for that because, of course, with the COVID slowdown and all of that stuff, there's a lot of workers that had come out of status. Do you know any of the stats coming out? They had an out of status workers stream that they also had. I think it was a pilot project in the Toronto area. Do you know anything about that and what was kind of found from those numbers?
No, I do know that there's a lot of discussion among economists that one of the challenges Ottawa has faced is that, to put it in simple terms, they can't accurately count the number of people in the country because the way our system works. So if your visa expires, Ottawa assumes that the next day you've left. And that's not the case. People stay.
Because you can't afford to buy a ticket to get out of here.
Well, they're staying because they're renewing their visa or they've got other opportunities or they're getting a different visa. And so CIBC, one of our biggest banks, estimates that there could be as many as 1.5 million more people in the country than Ottawa is counting. And so that's significant because it goes to the services we provide, how we provide them, goes to affordability and all the challenges that we're facing. So I think we've got to do a better job at understanding what our challenges are in Canada in terms of the shortage of people and then the opportunities to bring people in and have them help build our economy and have them look at the opportunity to live and work in Canada as a great opportunity to build a family and build a life here. But we sort of lost sight of that. And so we've got some work to do in terms of changing that and creating a dynamic. Because if you think of it, there are so many other countries where it's like we have the luxury of basically saying at the beginning of every year, we would like to have this many international students, this many new immigrants, this many, like we can pick that number. But we've done a very poor job of having the conversation to get to the right number. So we have better outcomes for Canadians.
Next, we have a bit of a rapid fire section to kind of get to know you a little bit better and some fun, your maybe fun, quirky side. And then also a little bit more of, if I ask the question fast enough, we might get a couple of good trade secrets in there too.
Okay.
So what's your favorite hobby outside of work?
Watching NFL football.
Really? Go figure.
Dallas Cowboys.
Oh, yeah?
Yeah.
Cowboys are good. Go-to comfort food?
French fries.
French fries. The last book you read? Not an audiobook.
How the World Really Works.
Oh, yeah? Do you read lots? Yeah.
I try and read a book a month.
Oh, that's good.
Yeah.
Your favorite vacation spot?
Sydney, Australia.
And then your favorite spot in BC, your favorite city that you come to visit?
Oh, favorite city in BC is Vancouver. I live in Vancouver. I love Vancouver.
Okay, yeah, and I hear you've got an apartment downtown near the seawall and stuff too. So
right on the seawall. It's great.
Yeah, just see a lot of people coming in all the time.
Yeah.
Your favorite movie of all time?
Wow. Well, there's a lot there. LA Confidential, Goodfellas. I could go on. I like movies a lot.
Yeah. So who's your favorite director then?
Martin Scorsese's great. Spielberg's great.
So are you then a morning person or a night owl?
Morning.
Morning. And what's one thing you can't live without besides your family and friends?
Coffee in the morning.
Perfect. Yes. Cats or dogs?
Cats.
Favorite type of music?
Pop music.
Favorite season?
Fall.
Okay. Secret hidden talent that nobody might know about?
I don't know. I don't know if there's a secret talent, to be honest.
Nothing fun? Nope.
No.
Favorite restaurant to do business at?
Any breakfast diner.
Earlier the better?
Yeah. I like breakfast would be my sort of, if I'm going to have a meeting, I like doing it over breakfast.
Because you're a morning person.
Yeah.
And good for construction industry too.
Yeah.
So one item off your bucket list that you haven't checked off yet.
I like travel.
Perfect. And if you can meet with any policy changer right now to get something done, who would it be?
It would be people like a Warren Buffett, Tim Cook at Apple, like people who are on the leading edge of change and making a difference.
Thank you very much.
Thank you. It was great to be here. Really appreciate the
Chris.
opportunity.
And before you leave, we have something to show a little bit of a token of our appreciation and maybe hopefully a bit of a gift for you. And it's a personalized tumbler with your name on it.
Oh, great. Thank you. That's great. I really appreciate that. Thank you very much.
That's all we have for today's show. Thanks again, Chris, for sharing the perspective from your organization and the tools and resources that you've developed to help serve the industry. Everyone, keep an eye out for your coworkers and colleagues and help direct them towards the resources that they need. And thanks again. Stay tuned for our next episode. Take care.